everyone, and welcome. Thank you for participating in the session and watching my presentation. My name is Jared Raymer, and I'm a PhD candidate at the University of Illinois in Chicago. Here, we will look at evidence to inform whether PE facilitators should focus primarily on children gaining more minutes of moderate to vigorous physical activity during PE classes, or whether facilitators should primarily focus on creating an environment where children develop an enjoyment of physical activity. Childhood obesity is on the rise. Over the previous 60 years, the prevalence has risen 10%, from 5 to 15. We know that physical activity is an important method to reduce the harmful effects of childhood obesity. The most common level of exercise used is called MVPA, or moderate to vigorous physical activity. So should we spend time in schools making kids exert this level of energy? We know there are a myriad of benefits to MVPA, both physically and mentally. Physical education policy, like all subjects, is based on state law. Policies today mainly either specify minutes of or percentage of class time in MVPA. Physical education, however, is where physical literacy will mainly be developed during the school day. Physical literacy is defined as the confidence, competence, knowledge, and motivation for an individual to be physically active throughout their lifespan. However, physical education policies largely lack language regarding physical literacy outcomes, which are an important determinant for physical activity and lifelong health and well-being. The purpose of this study is to examine longitudinal associations using structural equation modeling of the MVPA taking place in grade 5 PE classes on physical activity outcomes 1 year later. These associations are also compared to whether the children enjoy physical activity during the same time period. These variables' effects were also tested indirectly through the accelerometry measured weekday MVPA that the children exhibited. The hypothesis for this model was that there would be significant small to moderate direct and indirect associations between the independent and dependent variables. This study used data from the nationally representative longitudinal study from the NICHD Study of Early Child Care and Youth Development. Sampling took place in 1991 and included 1,364 families with demographics similar to national norms. Mothers were recruited in the hospital and asked to complete a follow-up interview in their home 1 month after their baby was born. Inclusion criteria from this interview were that mothers were at least 18 years old, spoke English as their primary language, did not plan to move in 3 years, and had a single baby birth. This is a secondary data analysis using structural equation modeling. Straight arrows show testing direct associations, and the curved arrow is a test of covariance between the exogenous variables. The control variables were also customarily tested as covariates in the model. The model on this slide shows only the significant associations found in the analysis. The model met all standard fit indices. Beta levels are standardized effect scores. Control variables BMI and sex correlated with PE MVPA, and only BMI correlated with enjoyment of PA in grade 5. Assigned female at birth was also negatively associated with sport self-concept and total MVPA in grade 6. Grade 5 MVPA did not have any associations with grade 6 variables. Grade 5 enjoyment of physical activity was positively associated with sport self-concept, total weekly MVPA, and enjoyment of physical activity in grade 6. Indirect effects were only significant on grade 6 weekly MVPA. Beta levels for the effects were very low, however, both being less than 0.1. According to this model, minutes of PE MVPA were not predictive of physical activity outcomes tested. Enjoyment of physical activity, however, predicted sport self-concept, future physical activity enjoyment, and weekly minutes of MVPA 1 year later. It is important to note that the two concepts of physical activity enjoyment and MVPA are not mutually exclusive. It is important for children to enjoy physical activity. Clearly, voluntary participation in physical activity is where most energy expenditure happens. Even in this model, children attain significantly more minutes of exercise outside of the PE classroom. Enjoyment has been shown in other studies to be a major contributive factor to future fitness program participation. However, this relationship seems to be affected by sex. A multitude of studies have shown, including in this sample, that those assigned female at birth participate in fewer MVPA minutes. One limitation of this study, as with any longitudinal study, is the attrition rate of individuals. The variable with the highest rate of missing data, accelerometer participation, had a greater than 70% rate of participation at both time points. Furthermore, missing data parameters were estimated using full information maximum likelihood, which uses all available data for each participant to estimate values. Future research should address more factors of physical literacy, which are important determinants of an individual's health, more so than solely attaining minutes of MVPA. These measures should include movement, confidence, and competence, motivation, and enjoyment. Here are the list of references used throughout this presentation with coordinating numbers. Thank you very much for listening and engaging with my presentation.